to another installment of Tales from Nursing, your informative news program addressing nursing practices. Tonight's episode addresses cultural care in nursing. In addressing this issue, we look to the theory of transcultural nursing developed by Madaleine Leininger.
The main idea behind my nursing theory is the care of the client as it relates to all facets of the person, including their rituals, folk care, and cultural preferences, to name just a few.
Madaleine Leininger was a Nobel Prize nominee for her work in integrating nursing with anthropology to develop the transcultural nursing theory. Dr. Leininger performed the first field study that combined nursing with anthropology in the 1960s, working with the indigenous population of New Guinea. She also established graduate-level programs in transcultural nursing, as well as starting the first independent PhD program in transcultural nursing.
After assessing clients, I have created 3 intervention methods that will apply to any client and how it relates to his or her culture. These are reinforcing cultural practices that promote health, finding middle ground between the folk care and evidence-based nursing practice, and finally repatterning the client's practices. To properly illustrate my model, I use a graphic known as the Sunset Enabler to discover cultural care.
Tonight's episode shows how to use Dr. Leininger's transcultural model while assessing a middle-aged Vietnamese woman named Hai.
Hi.
Hai is a widowed woman of 5 who is the sole supporter of her children and her mother. She presents with a broken leg and a mild concussion following a motor vehicle accident. She is anxious because she cannot afford to miss work because she has no sick leave. Her problems are further compounded by living in a 4th-floor apartment. Hai's comprehension of English is quite good for everyday conversation, but it lacks medical terminology. However, her children, ranging in age from 10 to 20, comprehend the English language excellently.
Applying Dr. Leininger's theory involves assessing both her and her cultural influences. Before seeing Hai for the first time, a culturally competent nurse will use available resources to learn information about the Vietnamese culture and customs. The nurse understands that all health decisions must involve the entire family, especially elders and older children, particularly males. A competent nurse will set the stage to provide the most comfort during Hai's interactions with healthcare professionals, such as observing customs and formalities of the culture. As she sees Hai for the first time, she will know that Hai will downplay pain and anxiety, but she knows that Hai's pain and anxiety must still be addressed. The nurse will discuss different strategies with Hai for managing her pain, such as acupuncture, acupressure, medical ointments, working with a shaman, or taking a mild pain reliever. This exemplifies accommodating Hai's cultural practice while still treating the client's pain. Additionally, the nurse will also address Hai's anxiety about missing work by informing her that taking the time to heal now will prevent later injury and damage that could cost her valuable work days and possibly her job. This is an example of cultural repatterning. The nurse will work with Hai to try and help get her shorter shifts over more days, or see if she has additional friends and family that could help her cover expenses and provide food for her and her family as she recovers. The nurse will also work with Hai and her employer to reduce hours worked per day and provide interventions, such as a stool for Hai to sit on while she works.
When using the OPT model to assess Hai, a diagnosis must be made first. Pain and anxiety related to a broken leg, mild concussion, and the loss of money from missed work days is evidenced by Hai's distress and cues from her client's story. Next, an adequate outcome must be designed. Hai will exhibit an acceptable level of pain within 2 weeks by working with an acupuncturist and taking a mild pain reliever as needed. High will express reduced levels of anxiety by talking to her employer about how to shorten work schedules and or accommodate her injury while on the job within 2 work days. Finally, a test must be set up to evaluate the outcome. The nurse will evaluate High's pain level in 2 weeks' time to see if the desired goal has been met. The nurse will also follow up with High within 2 work days to see if work accommodations have been made.
And that was an application of Dr. Leininger's transcultural nursing theory. Thank you for joining us for this installment from Tales from Nursing. Woo!